Hi, I'm Dr. Lisa Burgess, and I'd like to tell you a little bit about the Ideal implant. We've been very pleased with this implant in our practice. I think it fits a certain niche of patient. So sometimes I see patients and they want to have saline or silicone, but for the silicone, the implant has to be monitored by an MRI to look for a silent leak. But there's a certain population of patients that would really like to have a saline implant. The saline implant, if it leaks or has a rupture, then it just goes flat and you know it. There's no monitoring to it. But sometimes the traditional saline implants are just kind of like a floppy, bag of saline or salt water. But this is where the Ideal implant comes in just a little bit better because it is structured. It has a baffled type of system, so it's kind of layers in there of saline. So it feels a little bit more like a silicone implant. So I think you get the benefits of knowing if you have any issues with the implant because it's saline, but you have kind of more the feel of having a silicone implant. This implant is really quite nice for patients that have a smaller or more narrow chest diameter. So when we do measurements for the patient, we're kind of measuring kind of from here to here the size or the width of the chest. This would not be a good implant for a patient that has a really wide chest because it would look too stuck on and too narrow. So it would be better for somebody that's a little bit more narrow chest, somebody that has a moderate amount of breast tissue and wouldn't be too terribly thin. The patients that have had this done have been extremely happy with it. It's been newer to our practice, but it definitely is something that people are interested in, and I'm sure we'll be doing many more of them.